Hey guys, welcome back to our series Rhinoplasty or a nose job surgery. I am Dr. Saumil Shah. I am a board certified plastic surgeon. I am the director of plastic surgery division at Skinzone Clinic, Mumbai. In this video, we'll be going through step by step as to what we do during a rhinoplasty surgery. So if you've decided to get a rhinoplasty surgery done, surgery in rhinoplasty is basically of two types, which you would have heard quite a lot if you've done your research. One is what is called as open rhinoplasty and second is a closed rhinoplasty. Now what are these things? What do you mean by an open or a closed rhinoplasty? The difference is in how we open your nose or how we expose the structures that we are going to change in your nose. With an open rhinoplasty, we basically take an incision in your nose inside your nostrils, and along with that we also take an incision at the bottom of your nose in an area known as the columella. Through this, we open your nose completely and the entire nose is exposed. Whereas in a closed rhinoplasty, the incisions or the cuts are made only inside your nose. Now, there are reasons why sometimes open is done and why sometimes closed rhinoplasty is done. The advantage of an open rhinoplasty is that we can see all the structures and we can make the changes as required, and it is much more easy and better when we need to do extensive changes in your nose. When we need to do very minor changes such as just maybe decrease your hump a little bit or maybe some very small changes, then a closed rhinoplasty is good, because then we, even with that closed area and even with a keyhole type of a surgery, we can get the surgery done. Through these incisions, we then go into your nose, we open up the entire tissue of the nose and we expose the structures that are deep inside the nose. We expose the bones, the cartilage that we have seen during the anatomy. This is important because we want to do all the changes that we do for you under vision so that they can be done to perfection. In the nose surgery or a rhinoplasty, even millimeters of changes will make a big difference to how your nose looks in the end. So we don't want to compromise. When we learnt about the anatomy, one thing that I did not tell you is something called as the septum. Septum is the center line of the nose that divides the nose into two parts, the right and the left. A lot of the times, the deviation of the nose or the aesthetics of the nose is not right because the septum is not right. There's a saying that the nose goes where the septum goes, which means that if the septum is deviated to your left, your entire nose will seem that it is going to your left. Whereas if it is to the right, your entire nose will seem it's going to the right. If it is a short septum, it will feel that your nose is not projected enough. If it's a long septum, it will feel that the nose is too projected. So we first have to deal with the septum. Now we get to the septum by opening up what are called as the alar cartilages, the C-shaped cartilages that we said at the bottom. With opening up these cartilages, we go to the septum, we do the desired changes that are required in the septum, bring it to the center and to the required size. The next step that we do is harvesting what is called as a cartilage graft. Now what is a graft? A graft is a tissue that we take from your own body so that we can add it into your body without actually having to get its blood supply along with it. This is very helpful, especially in a nose, because sometimes we have to make changes to the dorsum, which is this part of your nose, which is called as the dorsum, the bridge of your nose, sometimes to the tip of your nose, sometimes to the interior of your nose, so that we do not compromise with the breathing. For all of this, we require what are called as cartilage grafts. The best source of a cartilage graft is the septum itself. So when we are doing the septoplasty, we also take a bit of the graft, a bit of the cartilage, leaving behind adequate septum so that it does not collapse, and we use this to then cut it out into the required shapes that we require for rebuilding your nose. If the septal cartilage or the cartilage in the septum of the nose is not enough, we can also use cartilage from your ears, especially if it is required for minor changes in your tip, because these are quite soft. If we require to do a lot of correction in your nose, and especially for redo rhinoplasties, a lot of the times we require what are called as the rib cartilage. So we make a tiny incision or a cut near your chest. In women, it will be under the breast. Through this, we get to your rib cartilage. This rib cartilage is an excess rib cartilage. We do not cause any harm to your breathing or any other deeper structures by taking out this rib cartilage. We then carve it out in a way that we can use it for your nose. And so this cartilage harvesting is done next. One of the most common things that people approach us about is problems with the bridge of the nose or the dorsum. One thing that can happen with it is that you may have a high dorsum which can form what is called as a hump of the nose. This is something that is quite common. Second thing is that you may have a low or a curved dorsum where it's not defined enough, and you might feel that the nose gives a very characteristic appearance where the dorsum or the bridge of the nose is not visible. There is a different treatment for each of them. When the bridge of the nose or the dorsum is too raised or there is a hump, it can be because of two reasons. One, it can be a bony bridge or it can be a cartilage bridge. If it is a bony bridge, we can sort of do what is called as rasping. If it's a small bridge, this is what is called as a rasp. So basically, we can use these sharp ridges and we just sort of brush or rub or saw that little bit part off. If it's a larger bridge, we need to use what is called as an osteotome. It's like a chisel. With a hammer, we basically break it so that we can, take the top off. If it is a cartilage is a soft structure. We can just use the scissors and cut it off and get the bridge to the level that we want. If it is too low, we can use the grafts that we described in the previous section, where we shape them so that we can fill them up in the top of your normal nose and camouflage it so that it comes up. The next is the tip of the nose. This is one of the most common problems that people come to us with, and the surgery for this can, if done alone, is also called as tipplasty. The most common problems that people come to us with are either a bulbous tip, some swellings on the sides of the tips, and sometimes a drooping or a too large or a small tip. Now all of these need to be done, are treated almost in a similar manner. We basically change the structure of the cartilage of the tip. We get it oriented in the right direction. Doing this also actually improves breathing in a lot of patients. We use again the cartilage grafts to either make them more prominent or make the shape more better and maybe even rotate it up. Now all of these things will be done depending on what the patient wants and what kind of a nose the patient desires. So these need to be discussed in minute detail before the surgery with your surgeon. Bones are something that we change very commonly in patients because of the simple reason that when we narrow the nose otherwise, or we get it up or down, a lot of the people don't want a very wide base of the nose. So in that case, we do what are called as osteotomies using those chisels and hammer, and we fracture the bone in a controlled manner and get the nose narrow. This also helps with the aesthetics and what are called as the aesthetic lines. There are different ways to fracture the nose, which again you can have a word with the doctor about. That is about the surgery, the different steps of the surgery. We then sort of do taping and plaster if needed for the patient, and the patient is then gotten out of the OT and shifted to the ward or recovery for a little bit of an observation, and in 2 to 4 hours we start the patient on fluids. To know more about what we do or what precautions you need to take in the post-operative period, do check out our other video where we tell you about the pre and the post-operative measures that you need to take for the surgery of rhinoplasty or a nose job, and we can discuss more in detail about it if you have more queries.